In the ever-evolving field of mental health, the recent introduction of prolonged grief disorder (PGD) as a recognized condition has sparked significant debate among researchers, clinicians, and policymakers. This controversy highlights the complexities involved in defining and diagnosing mental health disorders, as well as the challenges of standardizing diagnostic criteria across different reference materials. At the heart of this debate lie two primary diagnostic manuals: the International Classification of Diseases, ICD, and the Diagnostic and Statistical Manual of Mental Disorders, DSM. The emergence of prolonged grief disorder as a distinct diagnosis represents a significant development in our understanding of grief and its potential long-term impacts. Unlike typical grief responses, which tend to diminish over time, PGD is characterized by persistent and intense grief that significantly impairs an individual's daily functioning months after a loss. The recognition of PGD as a separate condition from other related disorders, such as post-traumatic stress disorder, PTSD, or depression, marks an important step in providing targeted support and treatment for those experiencing prolonged, debilitating grief. However, the introduction of PGD into the diagnostic landscape has not been without controversy. The primary source of debate stems from the differences in how PGD is defined and characterized in the ICD and DSM. These two manuals, while serving similar purposes, have distinct histories and approaches to mental health classification. The ICD, overseen by the World Health Organization, has a broader scope, covering all medical conditions, including mental health disorders. With a history dating back to the late 19th century, the ICD aims to be a comprehensive, internationally accessible resource. It is designed to be low-cost and widely translated, making it a valuable tool for healthcare providers worldwide. The ICD's approach to diagnosis often allows for more clinical discretion, recognizing the variability in how disorders may present across different cultural contexts. On the other hand, the DSM, maintained by the American Psychological Association, focuses specifically on mental and behavioral conditions. The DSM gained prominence with its third edition in the 1980s, which introduced a more research-based, standardized approach to diagnosis. This shift towards standardization was aimed at improving the reliability and reproducibility of diagnoses across different clinicians and research settings. The DSM has become the primary reference for mental health professionals in the United States, although it is also widely used internationally. The differences between these two manuals become apparent in their respective definitions of prolonged grief disorder. While both agree on the core concept of PGD, as grief that persists and interferes with daily life long after a loss, they differ in some of the specific symptoms they emphasize. According to the DSM-5-TR text revision, key symptoms of PGD include avoiding reminders of the loss, feeling intense loneliness, and experiencing a sense that life is meaningless. The ICD-11, however, highlights symptoms such as difficulty accepting the death, feelings of guilt, denial, blame, and an inability to experience positive moods. While there is significant overlap between these descriptions, the differences are notable enough to fuel debate within the mental health community. This discrepancy raises important questions about the nature of mental health diagnoses and the best approach to defining and categorizing psychological disorders. Some researchers argue for greater standardization between the ICD and DSM definitions of PGD, contending that a unified definition would facilitate more consistent research, diagnosis, and treatment. They worry that the current differences could lead to inconsistent diagnoses depending on which manual a clinician uses, potentially affecting patient care and research outcomes. Conversely, other experts see value in maintaining some flexibility in the definition of PGD. They argue that the current differences between the ICD and DSM reflect the complex nature of mental health conditions and the diverse ways they can manifest across individuals and cultures. This perspective suggests that a more flexible approach to diagnosis allows clinicians to better tailor their assessments to the specific needs and contexts of their patients. The debate surrounding PGD also highlights broader issues in the field of mental health diagnostics. Unlike many physical health conditions, mental health disorders often lack clear biological markers or definitive tests for diagnosis. This reliance on observable symptoms and reported experiences introduces a degree of subjectivity into the diagnostic process, making standardization challenging. In response to these challenges, the National Institutes of Health has proposed a new system called the Research Domain Criteria, RDoC. This approach aims to incorporate neuroscientific tools and findings into the diagnostic process, potentially offering a more objective basis for understanding and categorizing mental health conditions. The RDoC framework suggests using techniques such as electrophysiology and functional neuroimaging to identify neural circuits associated with specific symptoms, potentially bridging the gap between observable behaviors and underlying biological processes. While the RDoC approach holds promise for advancing our understanding of mental health disorders, including PGD, it also introduces new complexities. The integration of neuroscientific data into diagnostic criteria represents a significant shift in how we conceptualize and classify mental health conditions. This approach could provide valuable insights into the biological underpinnings of disorders like PGD, but it also raises questions about how to balance this data with the lived experiences of individuals and the diverse cultural contexts in which grief is expressed and understood. Despite the ongoing debate, the recognition of prolonged grief disorder as a distinct condition represents an important step forward in mental health care. By acknowledging PGD as a specific disorder, clinicians and researchers can develop more targeted interventions and support systems for those experiencing persistent, debilitating grief. This recognition can also increase public awareness, potentially reducing stigma and encouraging individuals to seek help when grief becomes prolonged and interferes with daily functioning. The controversy surrounding PGD's definition serves as a reminder of the dynamic nature of mental health research and diagnostics. As our understanding of the mind and behavior evolves, so too must our systems for categorizing and addressing mental health concerns. The ongoing dialogue between different diagnostic approaches, whether through the ICD, DSM, or emerging frameworks like the RDoC, is crucial for advancing the field and improving patient care. In conclusion, the debate over prolonged grief disorder highlights the complexities inherent in defining and diagnosing mental health conditions. While differences between diagnostic manuals can create challenges, they also reflect the nuanced nature of psychological experiences and the importance of considering diverse perspectives in mental health care. As research continues and our understanding deepens, the definition and diagnosis of PGD will likely evolve, potentially leading to more refined and effective approaches to supporting individuals experiencing prolonged grief. Ultimately, the goal of this ongoing debate and research is to improve the lives of those affected by prolonged grief. By continuing to refine our understanding and diagnostic criteria, mental health professionals can better identify and support individuals struggling with persistent grief, offering hope and healing to those navigating the challenging terrain of loss and recovery.